So our goal today was just to better understand where we are in terms of Delaware. And you have been now in this position for the last 2 years, and you have many different positions. You are wearing so many different hats. You are the chair of the National Lieutenant Governor Association, the lead voice for the Behavioral Health Consortium. You are an active nursing faculty, and also with the some of the new meetings that you are joining with the mental health awareness, youth mental health awareness. So you do so many different things, and then you still do your full-time job, which would be the Lieutenant Governor of Delaware. So how is it going so far?
It's going really well. Thank you, Kemal. I think those of us of kindred spirit who are very committed to the health and well-being of our communities juggle multiple hats. And I think that's the fact of many of those who are there with you at United Health. The many women and men that you employ, I think, juggle to make things better. And for me, it's just been an incredible journey. We can talk a little bit later, but the things I have learned through my 6 years in the House, 9 years in the Senate, and now the past 6 years as Lieutenant Governor about the ways to uplift Delaware and everyday Delawareans, making sure that we have bold plans in place to protect our small jobs and our small businesses, as well as our corporations, but also the health of Delawareans. And we can talk a little more later, if you'd like, about some of the things that brought me to the dance of policy. As a nurse and as a young farm girl from Sussex County who had the opportunity to travel with my husband in the military while I finished my doctoral studies. And, that journey and what has brought me to make sure that with Governor Carney and our General Assembly, that we do have a strong economy. And the last thing I'll say before we jump into, I'm sure, more conversation is through COVID. What did we learn? We learned that the health of our community really determines the health of our economy. And it is just so important that we work together and we do the best models that we can. And I've stolen a few good models from other states around best practices, whether it's in education or healthcare. And I know a lot of eyes have been on Delaware to model some of the work that we've done in behavioral health. So thanks for having me today.
Well, of course. Now, many politicians, they run for positions to serve. So, and in many cases, when they take over, we see like complaints and just blames, and we haven't seen that from you. And I believe this past 2 years, it was challenging for all of us, not just for the state, but for the country and the individuals, companies, as you mentioned earlier.
Yeah.
So now you run for this position thinking that you were going to do so many different things. But then when you get to the position, maybe things were different. If I were to ask you, what was the most challenging issue that you have to dealt with in this last 2 years?
That's a really important question. We've had a twindemic across America, and chairing the National Lieutenant Governors Association and also leading the National Million Women Mentors, which is a STEM program. I think the global economy and the global community that we have witnessed with the health. And when a twindemic, what I'm speaking about is both the COVID pandemic and our opioid epidemic. Prior to COVID coming, I did indeed, like you said, have the pleasure and continue to serve the state and serve in a caring way that allows me to actually be on the streets as a professor, PhD professor doing research at the University of Delaware, whether I'm in Sebbyville or I'm in Claymont. Really important that we make sure that individuals were protected. And for those who are suffering more mental health and substance use disorders, as you well know, with your work with the ACO and your providers at United Medical, that you've had to really be nimble. And the thing that was most challenging for us was being able to protect our Delawareans while keeping the economy going. And so we kept open our construction agencies and facilities. We kept open our early learning. We did those things that we knew, but doing it safely with the Division of Public Health. And that was a challenge, but also coming forth with smart models. There is no I in team. Collectively, we really implemented some best evidence-based practices in population health. For example, when the first day of shutdown occurred in our state, we hit the streets. I was the undercover lieutenant governor. Nobody knew who I was, covered in full PPE. We had no vaccine at that time, but we went to our highest risk neighborhoods and we did COVID testing and working collaboratively as a team with leaders in the health community and providers. We were able to, with Aquila services, take the most at risk, put them in shelters and help provide services. And proudly, I can say that Delaware was one of 4 states that during the COVID first year of the pandemic and the opioid epidemic, we actually had a decrease in the percent of overdose deaths. We know fentanyl and carfentanil have been extremely deadly, and we were very proud of that. Now, the number of persons unfortunately succumbing to overdose deaths has not decreased. It has continued to rise across America. That's why our Behavioral Health Consortium and the Opioid Settlement Commission that has been formed in collaboration with our Attorney General's office, that we are really putting forth some best practice models for others in the country to emulate. And so those 2 things combined have really been the most challenging, the opioid epidemic and the COVID pandemic simultaneously.
So now I guess the budget would be one of the biggest challenge also, right? So then you guys have to go through. I don't know if, maybe we should have told people. So you and I, we met first time, I believe, last year at the SBC, the Brandywine Valley SBCA's.
Yes, the SBCA.
Right? So,
yes.
And because, when we do these events, sometimes, I hear people talking about like, oh, they knew each other and they were friends. But we talked maybe 2 or 3 times in this whole last 12-month period. And it was very limited. You came to our office once. We had maybe 2 or 3 phone conversations. So, but many of the people may not know that in 2008, 14 years now. So I was part of the transition committee of Jack Markell. So that's kind of like an interesting concept for the rest of the world because they don't really have that. So, and it was kind of fun for me. It was a lot of learning, but also it was so challenging to understand how the budget is made because I'm running a private company. So for us, if you have it, you have it. If you don't have it, then you are out. But for the state or the country, it's not in the same form. So you have to still provide certain things. You have to borrow certain number of loans and other things that you still have to provide. So how did you guys overcome the budget issues? Now, just to give you, just a simple number. When I did this transition committee time, the budget was under 3 billion. And our population didn't go up much in the last 14 years, I don't believe. Right now, we are at 4.7 billion. Right, so this increase is a very big increase. And you and John Carney, our governor, you guys are dealing with this challenge because there's no income coming in other than our taxes and other stuff, right? So how do you overcome those challenges?
Well, I've had the opportunity, like you said, to serve budgetarily on the state budget bond committee when I was a member of the legislature, and you're spot on. Thank you for your service with Governor Markell, who did a fabulous job of reminding us almost every day that we are a small state of neighbors. And I had the honor this past year to oversee what is known as the complete count, which is actually the census for Delaware. And we are around 11,000 shy of 1 million persons. We're at 879,000 or so in our state, and or 89,000. We really, truly have a state where we've had the opportunity proudly to keep a triple rating in our bonding. I can tell you, sitting at those committees during 2008 to 10, when we suffered the Great Recession under President Obama and the leadership then of Governor Markell, and then in our first year with Governor Carney, the true budget deficits that we faced, it was very hard. It was very hard. We didn't have funding for the infrastructure. And right now, for fiscal year 23, it's around a 5.1 billion operation, of which we had 370 million in one-time supplemental appropriations. And again, we were able to do good things with those extra funds. And a thank you to our congressional delegates with whom I know you have worked closely. Congressional Congresswoman Lisa Blunt Rochester, Senators Carper, Senators Coons, who sent to our state through both CARES Act and ARPA dollars the opportunity to infiltrate and very important both one-time capital and other operations funds. And when Governor Carney had tapped me to lead statewide hearings, I had to host approximately 11 hearings in like a couple of weeks. And it was a painful time. And it was when small businesses in particular, which are the economic drivers of our state's economy, it was challenging. And so we listened and collaboratively working with the General Assembly came forth with a budget that would not only have implications for the current time, but actually elevate and uplift and put monies back into the economy. For example, in fiscal year 23, we did around 104 million extra dollars for a 3% pension increase for former state workers. We've also implemented, thanks to Senator McBride's leadership, the first launch of some of the funds for medical leave for families. And one really important item for me and for you and others is making sure families have support through early education, not daycare, but early education for brain health development of our youngest birth to 5 and putting that into equitable communities. The one thing I did not mention previously when you asked about what the challenges are, we saw through COVID the gaps in equity in Black and Brown communities. And so while you laid a vision out, thank you for that, during Governor Markell's transition, we have had to have a vision to the future here in Delaware now. And we have this opportunity in our budget to begin to also look at equity across the board, but doing so in such a way that we're also very mindful for entrepreneurship and for both large corporations as well as small business. And I know you've worked with, our prosperity partnership, our, corporation section, our division of small business, minority owned community and based businesses to really make sure that these funds were dispersed equitably across all 3 counties. And I could go on a while about operational budget, the capital budget.
So I think we can probably, I can help you with with a couple of questions.
Sure,
maybe
absolutely.
with the budget to the most expensive items in the budget.
We know what they are, don't we?
Right. So the public education, about 36% of the budget where we spend.
Yes.
And the second biggest one where I believe that maybe I have a better understanding from the healthcare side, as we are the healthcare providers, health and social services. This is like 27% of your total budget, and between these two, it's more than 60%. So that's a lot, right? So where we have 2 guests together, especially with the state officials. So we try to kind of keep it with one. But then because we are getting really close to the election, we want to make sure that we can reach out to as many people as possible. And Sarah, actually, this is your 3rd time in the show, and I really do appreciate your support and willingness to take the time. With Representative Melissa Minor-Brown, this is our first time we ever met. In fact, we were just saying that 5 minutes ago when you just logged into Zoom, that's when we met. So, and we make a lot of good friends. Last week, I have Lydia York, never met her, talked to her once on the phone. And it was a great conversation. It felt like if we knew each other for a long time. And usually that's the feeling that we get from these sessions. And I do want to thank you guys for joining us and helping with the message that we want to give out there. Now, we have our format in a way that nothing is set in stone, so we do change it very frequently. So in this one, we want to do the same. So I do want you guys to perhaps introduce yourself, and then we are going to talk about the current items that perhaps current bills that you are working on. Maybe we can start with Melissa, or Sarah, if you want to start first. Whoever wants to go first is fine.
So I'm Melissa Minor Brown. Of course, I'm a state rep for Delaware's 17th district, which is the majority of Newcastle. And I am a nurse by training. I am vice chair of the Health and Human Development Committee, chair of the Corrections Committee.
All right.
And good afternoon. It's wonderful to join you again. And it's great to be on with my wonderful colleague, Representative Minor Brown. She and I were just actually together in Lewis yesterday at a roundtable on nursing workforce with Congresswoman Lisa Blunt Rochester. And so it's great to be with her on back-to-back days. My name is Sarah McBride. I am the state senator for the 1st State Senate District, which includes parts of Wilmington as well as Brandywine 100. And I serve as the chair of the Senate Health and Social Services Committee. I almost said Human Development Committee, but that's the House name. And I was elected in 2020, so I'm entering my 2nd term after 2 years.
All right. So I know you guys are very active with the bills that you are sponsoring, the one or co-sponsoring. If we can just have like a background of what you have worked recently. Now with Senator McBride, we covered the paid family. It was kind of like interesting in a way that it wasn't like first time when we talked, it was in process, so it didn't happen yet. So then you came back when it did pass. So we were actually really happy to be part of that process. But I know you have so many other bills that you are working on, and because we never met with Melissa, so we don't know what she has done. We have some information, of course. So if you can just give us a brief background on the latest thing that you have worked on, just final, and then the new stuff that you are working on.
Sure. So, well, you know what? I'll tell you really quickly. You know, when I ran for office, one of the major reasons why I ran was because one of my patients had passed away because he could not actually get the medication that his doctor prescribed. And you probably are aware of step therapy, how, you know, you kind of have to try all these other meds first before you can actually get the med your doctor prescribed, because insurance companies place barriers on that. So actually, when I ran for office, that was one of the first bills that I did. So I'm excited to say that I championed step therapy as a brand new legislator 4 years ago. But this past session was amazing. We've gotten so many bills done, healthcare bills, criminal justice reform bills. But I think my big baby literally was the Momnibus package. And just to give you a few stats, I won't talk too long about it, but just from 2011 to 2018, Black women actually made up 1 in every 4 live births, live childbirths, but over half of the maternal deaths, the deaths that were related to childbirth, were Black women in Delaware. And this is a national crisis that we're seeing. So this was a package of 6 bills, all related to improving maternal health in our state, addressing maternal mortality. It talks about shackling of women who are incarcerated. We expanded the postpartum Medicaid coverage to 1 year postpartum versus the 60 days postpartum. We included doulas and midwives into our prisons because that's where the women are most vulnerable. What else did we do? We made some changes to our Maternal Mortality Review Commission to ensure that it was a diverse commission. And we're actually looking at the socioeconomic status of women and just some other factors as well. What else did we do, Sarah? What else was in that Momnibus?
So I think the better training for the workforce, right?
Yes, implicit bias training, and not just any training, not just the quick yearly training that you just check the box. This is going to be evidence-based implicit and explicit bias training. And we've actually created a committee to actually work on how we're going to deliver that training. So that one was a big deal as well. And of course, Medicaid reimbursement for doula coverage. So every woman can have access to a doula.
That's the term for midwife, is it?
No, so a doula and a midwife are two different titles. A doula is actually, it's like a woman's advocate during her pregnancy, during her childbirth. It's the person that helps her carry out her birth plan. She's there to educate her on what to expect. She's there to answer any questions, prepare her for doctor visits, and then work with her in the delivery room and postpartum as she becomes a new mom and gets acclimated to that. And then one other thing I just want to mention is House Bill 455, because that was something that we had to work fast on when the Supreme Court overturned Roe v. Wade. We quickly got a bill drafted that would protect women's rights to reproductive health care in Delaware, also protect our clinicians, and also protect women who visit Delaware from out of state seeking reproductive health care. So that was a big deal. We got it done. Literally, like, hardly any opposition at all. We just got the bill through. So I'm excited to say that Delaware is a safe haven for women coming from out of state, and women have access to abortion services.
When I was going through these I want to say the name right. So I was just calling yesterday Monibus, but it's a Monibus, right? Monibus package. So I think this kind of aligns with things that we try to do with the SDOH, social determinant of health. So because some of those missing pieces are not going to be provided by the healthcare providers. So I don't know, in the beginning, if you were able to see, we provided services for more than 100,000 Delawareans in the last 9 months, in the amount of total number of 400,000 appointments. So that's the number of interaction that we had with our patients. However, when you look at the work that we do, especially the changing, the way that population is changing, the expectations changing, everything is happening today. Providing traditional healthcare is not fixing the problem. So it is requiring multiple different pieces. Social determinant of health is getting more momentum now, but we actually started doing that even before, because we understood that without having a social worker in the network, there are some patients we won't be able to have the good communication. Therefore, we can actually really provide the good care. Right now we have about 15 nurses who are working as care managers in the central office. And now we feel like there are more needs for, like, it would be great if we have like more social workers, more advocates for the service that we are providing. So reading all these, I do see a really good connection to the healthcare, which is like either number one or number two biggest problem that we have from the budget standpoint, also from the social standpoint. So I think you won't really see any oppositions to these issues. Hopefully you didn't, that's what you were saying, but it's good that you are able to make these things, put it in a way that it is actually more structured and then everyone can actually understand and benefit from it. Thank you for that.
Thank you.
Now, Sarah McBride is quiet today.
I'm just sitting here admiring all the amazing things that my colleague did in this last term. I'm finishing my first term more hopeful than I was when I started it, because I believe that this General Assembly has, at the end of the day, been the most productive General Assembly in modern state history. From gun safety to abortion rights, as Representative Minor-Brown mentioned, to minimum wage and paid family medical leave. We've made real significant, meaningful progress on a whole host of issues. And if I talked about all of those things that all of my colleagues did, we'd be here all day. So I will focus in on some of the bills that I was proud to serve as a prime sponsor of. You did mention paid family and medical leave. I would be remiss if I didn't just once again highlight that I am proud that Delaware has become the 12th state in the nation to pass legislation creating a statewide paid family and medical leave insurance program, which provides partial wage replacement to Delaware workers who are out on leave to welcome a child into their family, to get healthcare treatment for a serious health condition or to care for a loved one struggling through a serious illness. Is the largest expansion of the social safety net in modern state history. And I'm thrilled that we were able to get it done with a bipartisan supermajority in the Delaware General Assembly. In addition to paid family medical leave, which was sort of my baby as well. I think it's both the omnibus and paid family medical leave are worthy of being called babies in every sense of the word. But beyond that, one of the most important issues that I think we tackled in healthcare, in addition to the omnibus and paid leave, were a series of bills around expanding access to mental health care here in Delaware. So Representative Longhurst sponsored a series of bills. I was the Senate prime sponsor of one of those bills that expands mental health counselors in our middle schools. We had done elementary schools the year before, requires insurance companies to cover annual mental wellness visits within state regulated insurance plans. And then a bill that I was the Senate prime sponsor of, legislation that creates statewide mental health curriculum and educational programs within our K through 12 public schools. Within the mental health space too, I want to specifically mention, we know that provider burnout is obviously a huge challenge for our healthcare system right now. It's having a tangible impact on both the wellness of our providers and the outcomes for our patients. And several years ago, Delaware had adopted fairly draconian mandatory reporting policies for physicians when accessing even routine mental health care. And so we reformed those policies to reflect best practices, to open up pathways to mental health care without putting physicians' license at risk, because we know that to care for others, these providers need to be able to get care themselves. And so we were thrilled. I was thrilled to be at Christiana Care this summer for the governor to sign Senate Bill 300 into law, which will allow our physicians to get mental health care, including routine mental health care like treatment for depression or anxiety, without putting their ability to practice at risk. We have really been focusing both this past General Assembly and moving into the next one on dental care. That is a particular passion of mine, and Representative Minor Brown and I have been working together on this. We too often bifurcate healthcare between medicine and then dental, vision, and hearing. And I think that bifurcation of care is having a really dangerous consequence for patients. And it's time that we prioritize the full range of healthcare that people need to live and to thrive. And dental care really is, in addition to primary care, the only area of care where everyone should be getting care routinely throughout their lives. And right now, Delaware struggles when it comes to access for care. Some surveys find that Delaware is either 46th or 50th in the nation when it comes to dentists per capita. And that has significant impacts in terms of access. So residents, particularly in Sussex and Kent, are facing a real provider shortage, a dentist shortage. And so
that's interesting. You mentioned it, dental, because I think it was 2 weeks ago, we have our diabetes program, accredited diabetes program, and we don't have a dentist in our medical network, but our dietitian actually did reach out to her dentist, and he was with us to provide some education for those patients who are suffering from diabetes and how they should be doing their dental health. But it's not just specific to one group. So dental health is, as you mentioned, it's like one of the maybe most important, because everything starts from here.
Yeah.
So if you don't take care of it, it's interesting how sometimes we don't really pay attention. But we just brought someone 2 weeks ago, one of our sessions, we have that on a Wednesday night, and it was really interesting how he was actually explaining and how actually certain disease actually can become more severe if you don't take care of the dental issues. But I'm glad you are doing that.
Yeah, it's really become a huge passion of mine. So we passed legislation that will help our federally qualified health centers to fully staff these beautiful state-of-the-art dental clinics that they have up and down the state that are now either shuttered or operating at reduced capacity. Now they're finally able, because of a new pathway to full licensure that we adopted, they're able to now attract recruit and attract dentists to Delaware and to work in these federally qualified health centers, which will dramatically expand access for patients in more underserved communities to be able to access dental care. Representative Minor-Brown and I are actually co-chairs of a dental care access task force that is currently meeting to outline future recommendations for reform in this space to build on that progress and to make sure that no matter where you live in Delaware, you're able to easily you're able to access affordable dental care easily. In addition to that, just 3 things I want to make sure I mention. Telehealth. Mm-hmm. We've made various reforms to telehealth. Representative Benz and I, particularly 2 years ago, passed legislation that takes some of the lessons learned from COVID and make sure that they're implemented more permanently here in Delaware for telehealth. There's more to do. The health committee also oversees social services, which includes the kids department. And we were able to pass legislation that tackles one of the most frequent issues we hear from youth in and aging out of foster care, which is a lack of access to a driver's license and auto insurance. So we've reformed policies to open up pathways to driver's license for youth aging in and aging out of foster care and to subsidize auto insurance for youth in and aging out of foster care. That was a bill I was really proud to work on with Representative Heffernan. And then finally, the last thing I want to mention is outside of the healthcare space, but I think something that is really critical for the health of our democracy and our own mental health is legislation that creates the nation's most comprehensive digital citizenship standards in our K through 12 public schools. That's educating students on everything ranging from the mental health consequences of bullying online to how to be discerning consumers of news and information online, to identify fact from fiction, disinformation and misinformation, opinion from hard news, to give students the tools necessary to safely and responsibly navigate the internet for themselves, for one another, and for our democracy.
You know what, Sarah talked about the kids department, but you didn't talk about a big win that we had with the funding for the kids in the juvenile facility for them to now receive cognitive behavioral therapy and job training.
Yes.
You know, before they go out into the community,
This was a bill that Representative Minor-Brown introduced. I was really proud to serve as the Senate prime sponsor of, that invests hundreds of thousands of dollars in reentry supports and services for youth exiting our juvenile justice system, cognitive behavioral therapy, and also professional
training. Yep.
Yeah, professional help.
Kemal, if I can just say, to all the women that are watching today, experiencing, as the doctor said, the lack of sleep, the fogginess. I've seen women have to almost strip down to get out of their clothes. And if you're sitting in a business meeting, it's a little uncomfortable. Or the back of the head starts sweating, and so the hair grows wet, or you see someone starting to fan. Like, these are all real, true life scenarios that are taking place with women that are, entering into the menopausal phase of their life. Again, as a woman, I've had 3 children. I think I've bared enough that I should be able to skip over this part of it. And the fact that you just enlightened me that it could last 7 years, it makes me, yes, it is probably not tolerable. It won't be tolerable in our home if I have it for 7 years, for sure.
Well, I also, sorry.
Go ahead.
I was going to say, so I think someone who's been through it, hopefully closer to the end of it, I think it is different for everyone, and it can vary from time to time, right? Because early on, I didn't have the sweats. I mean, I'll just full disclosure, I felt it more internal. So like my torso, I felt very warm. And almost like if you put your hand up, like almost like you could feel the heat like radiating off of me. So I didn't have it up here as much, but I've worked with people that would literally break out into a sweat, like you said. So I think you have to realize that it can be very different for different people. That was more for me. I did have the night sweats. That's where you wake up and you're like sweating, kick off the covers and you're cold and you're putting the covers back on. So it can vary. I mean, some days it happened multiple times a day. Other days, not as much. So, but yes, it has gone on for quite some time. And I think, again, being aware, and Dr. Belisena, maybe you can address this. I know for me, because I was only 45, but also your family and the history there, because my mom started very young too. She was less than 45. So I think also being aware of your family history and when, that may begin for you, could be earlier than for other people. So just kind of right, Dr. Belisena, it does.
Yeah.
There is a bearing, like genetics, right? And family history can play a part in that as well.
That's a
And
great
it really,
point.
and it really varies. Initially, people can have like really bad symptoms, maybe I would say ballpark 1 to 3 years, but they dissipate. They really dissipate throughout, like moving into the 4th or 5th year. And some people, and the flip side too, like, oh, am I in menopause? Well, you asked a question, when was your last menstrual? I don't even remember. So is it more than a year? If it's more than a year, yes, you're in menopause and they don't have any symptoms. I said, yay. And they asked me, do I need to take anything? I said, do you feel any different? And then, no, you don't take anything. They're like, oh, okay, because I thought I need to take something. No, you don't need to take anything.
Yeah. Dr. Belisena, what I think I also hear a lot of women talk about is the weight gain. All of a sudden, the weight gain is right in the midsection. And people will say, well, I eat healthy, I work out.
Yes, unfortunately, yes. So that you're like, I think if I could count the gazillion number questions, that's all I've been asked about. So anyway, so what happens, obviously, when we go through menopause, I mean, women, we're double whammy, right? Double whammy. We have our kids, our belly becomes flabby because of all the things that we need to do. We need to wash the dishes, everything. We don't take care of ourselves. We don't take care of number one.
Mhm.
So I always try to say, please exercise, whatever shape or form. Doesn't matter to me. We need to exercise, right? And not only that, as we, when we're there in the perimenopause climacteric age, it's important for us to do weight training. Because men, because they have the testosterone, they have the muscle mass, right? But if we don't do weight training, our muscle mass diminishes, and that's responsible for metabolism. That increases our metabolism. So that's really number one. That's the key there. The hope is if we increase our muscle mass, then the chances of us maybe increasing our metabolism, yes, and then losing the weight. But that's like, I wish I wrote something, but because that's always what I'm eating less, I'm exercising more.
Mm-hmm.
I don't know why I'm not losing the weight.
Yeah.
Yeah.
It's a true struggle.
Yeah. Mm-hmm.
And, at least when you're pregnant, that you're getting a beautiful surprise at the end.
Right.
In this case, the surprise is that it's just staying with you and there's no end to it.
Yeah. So we have to take care of number one. It's not being selfish.
There's
but
no
it's
good
really...
surprise here, right? So let me actually ask you guys, maybe just address a couple of different things. So one of the things is like engaging in mentally challenging activities, right? This is apparently helping to keep so the better positioning yourself. Let's say it's not going to make it a lot easier, but it will make it somewhat easier. So exercise and all those. But as I'm listening to you guys, one of the things that we see, Donna and I, we run case conferences, Senator. So part of our accountable care organization, every day we have 4 nurses, 1 social worker, 1 business development. She's running 1 team, I'm running 1 team. And what we have seen and what I learned a lot is how our social determinant of health becomes like the main factor. So everything that you are talking, like I'm talking to 3 very intelligent, very well-educated women in the society. But if this person who's not in your situation, with the poverty, with other social challenges, this issue is even bigger for them than what you guys are going through or what you already went through. Is that right?
Not necessarily.
No.
No.
So like
So
they
it's,
wouldn't
yes,
know how
it's
to
not a
handle.
problem. It's not, well,
No, what I
they,
meant was actually like you know what's coming. Let's say you are better educated on this, but then people who don't know enough about it, they may not know what they're going through, and then they don't know how to handle it. That's what I was.
from my experience, it's usually the more educated women that would complain, that would come in and
Right.
say,
Okay.
yes. And because to them, probably because of other issues, it's not even worth talking about or not worth complaining because they have other problems to think about and they're just dealing with it.
But that isn't that so interesting though? It's kind of like opposite of what we normally have in healthcare, right? So you are saying that they wouldn't actually realize what they're going through because they have a lot of other social challenges. Interesting.
Yeah, because what I find now, the women that come in and say something, about this is usually, they're working, they have a full family affair wherein, they're taking care of the children, but it's not because that they're not working but they're taking care like of four kids, driving these kids to all their school activities, but it's usually in the higher tier that these women complain. I mean, it comes after the fact. Like, when we do a review of systems, we ask this and this, like, do you have hot flashes, night sweats? It only occurs or it only comes up when I ask them, but they won't necessarily say that it's a problem for them. Yeah.
So then I'm again just thinking since Senator also is part of the health committee, so perhaps we can maybe increase the awareness on menopause for those who may not have the same understanding or access to this. So again, it comes to the making them aware and they understand what they may be going through. This happens. Isn't this the same thing like with morbid obesity? Sometimes they never say anything about what they are going through unless physicians are approaching them. So it's kind of like similar to that. So that's actually interesting. So that's maybe something that we need to change our approach on our side. Now, so Senator was making some statements regarding the personal, what she was going through personally and what happens with the family. But the question would be, what do you suggest to the families or the friends, family members, how they should actually handle the situation? What's the best way to approach the issue, or should we not approach it at all?
So be kind, be nice, make sure that you are, doing all kinds of kind things for the women around you that could possibly be going through this. I think, right? I think I can probably write a whole list of things, but they would be the first things, Kemal, that I would encourage you as a man to make sure that you do.
That's
important because I guess
anyway, all the time, right? All the time, not
all
just
the time,
not just during perimenopause. It has to be all the time.
But being 110% instead
right,
of
Donna?
right?
Exactly. I'm making light of it because the reality is that I also would like to say that, oftentimes a woman may not realize that they're heading into this, right? Because is it perimenopausal, right? Where there might be some signs, but not necessarily because you might say, well, I'm only 45. There's no way I could, people don't go into menopause till they're 55, 60. And so they may not even realize that they're reacting, but it is something that chemically is changing in their body. And so I was making light of it, but just in reality to it, some women may not even realize that they're heading into this part of their life and because they're basing it on the age. Because I don't know, again, that we really are talking about this. You hear women talking about weight gain, you hear women talking about not sleeping and hot flashes, but I don't know that that's a big conversation right now happening.
Yeah, and not only that, maybe, as you said, women aren't realizing this, but you're seeing a lot of depression and anxiety as well during this time, and without them realizing, yes, it could be perimenopause, menopause, and that, it could be dealt with differently, not just with, medications for depression or anxiety, but also to take a look at the hormonal level.
That's what I was
For
getting
sure.
ready to say, is I think being aware of that the hormones can make us feel different ways.
Mhm.
And if you realize what's going on or see a doctor to find out what's going on, then it makes you maybe better capable of handling some of those situations, right? Like some of the things that we would normally handle, very easily, and then we become more emotional in certain situations than normal.
Mhm.
So again, being kind or being aware of what someone may be going through at that time.
Mhm.
But I think maybe what I was maybe also trying to say there is what I'm asking, should we also talk about it with them, or should we not bring it up at all? Like, I can be kind all day, so they know like I'm always nice. But should this be discussed, or when should we discuss this? What's the right time to discuss this? So
And we're all silent.
So,
I don't think there
I'm
really
trying
is
to-
any.
I'm
I
trying
don't
to
think
make
there.
you. I'm
Yeah,
trying
I
to
don't.
ask you uncomfortable questions for you guys, so that
Well,
we can. Maybe there are people out there they want to ask the same question. So I'll tell you. Okay. So I hope. Well, actually, my sisters are watching, but so one of them is older than the other one. So I'm one of 4 kids. So oldest and youngest are my sisters. So I want to be able to, like, I can tell you, I'm probably guilty of maybe making jokes about menopause. And I'm not going to lie to you. So like Sean may lie about this, so he's here. But
I've never made jokes.
Other people may lie about this. But I'm just being honest. Where we do make jokes about this, even to the person who's going through this. That's why now listening to this, and why actually we were even talking about this from the beginning. Why we needed to talk about this from the beginning, because there's that social impact of this whole issue where we don't know how to handle it. Like when you say be kind and be nice, that's a little bit easier for me because I do love my sisters. But because it's family, sometimes we also kind of like torturing them with mean jokes. Like, should we even know that they are going through this? That's why I'm asking this.
well, yes and no, because there's some women they're freaking, like, I'm not in menopause. They really deny it. Like, no, So it's both sides. It's, as I said, you can't cookie cut it. There's really no right answer to that, because some women are, they're fine saying, I'm in perimenopause, menopause, and I have this, like, be nice to me. Some others know, like, they don't want to even talk about it. So
Because they're very private, or like
yes,
they're either private or they don't want to accept that they're going through it.
exactly.
And, I think you kind of have to play off of it, and maybe more general questions like, are you okay? How are you feeling? Let them be the ones, like, based off a general question, let them be the one to bring it up. Then you kind of know where to go. But I don't know that I would have personally wanted someone to kind of ask me,
Exactly.
excuse me, are you going through menopause? Is that why you're cranky today?
Well, I also think, Kemal, maybe men don't realize, or maybe people in general don't realize, when a woman is having a hot flash and they're taking layer after layer off, that there is a chemical reaction to whatever's happening in their body. I can speak for myself back in when we were having children. In order for me to get pregnant, I had to do a short stint of menopause through IVF drugs. And so I had the onset of the menopause and the hot flashes. And they could be pretty grueling, but sitting in a business meeting as you're sweating through your suit is not a very comfortable position to be in. And so you have to kind of work through it. And fortunately, no one said anything to me, but I'm sure they probably thought, wow, she is red like a tomato. And now she is down into like a t-shirt at this point from a business suit. So, but maybe just knowing what the signs are
Right.
is just enough to reinforce, like, okay, this person is having some challenges at this time.
No, that's helpful. So, what else would you like to share regarding menopause? Any suggestions to those who may be going through menopause or who are about to go through menopause? What's the best suggestion you would give them?
Also, on being nice to yourself too. Like, women are very hard on themselves, period. And they want to be, they want to present themselves in a way that, especially as you said, Senator, when you're in a business meeting, you have your, set preference. And then when these things happen, it's uncontrollable. You cannot control these things, right?
Right.
So then it's on you. So then that's who I am, and deal with it. Like, it doesn't take away from who you are really. It's just a phase of life, and understand that it's going to get better.
Yeah. I love that. Right. Be kind to yourself.
We have
Absolutely.
to. We
Yep.
have to. Yeah.
And I liked whoever just mentioned a moment ago about the awareness, because I think, right, we spend a lot of time talking about other diseases and other illnesses, right? Awareness. We have Awareness Month for various different diseases. And I think you're right. It is an awareness that it can, affect people very differently. People can have, different symptoms. They can have some symptoms early. They can have worse symptoms than other people, but we have to be accepting of how they're feeling about their symptoms, right? So someone could have more mild symptoms, but maybe be feeling worse about it than someone who has, more severe symptoms. So I think it's just that awareness of allowing everyone to perceive that, for themselves and to work through that.